Because people with Parkinson's have an accumulation of acetylcholine,
Okay.
so that's why it blocks it, because that way it'll help them relax and stop the tremors.
The tremors.
Okay.
And that's because of accumulation of acetylcholine. That's why it's anticholinergic. Okay.
Okay.
So it helps with anti-tremors. You know that pill rolling thing that they do. You know,
Their
like
hands.
this. And
Yeah.
It helps with that pill rolling. And head bobbing that they do, and it'll help
Yeah.
with that.
We got some at
Yeah.
our clinical site.
Yeah. But you know how they move slow? It doesn't really do anything for that. It just helps
Okay.
with the tremors and stuff like that. And the side effects is the same with the other anticholinergics, the dry
Okay.
mouth,
Okay, dry
everything
mouth.
like that.
Okay.
Okay.
And these, they give synthetic anticholinergics. There's less adverse effects, and those for these ones, the drugs for this type of anticholinergic, it's not your atropine, it's your benzo, what is it? Benzotropine,
Okay.
Prine. It's also called, you probably remember your Calgentin. Does that sound familiar?
Yeah.
Mhm.
Okay. Also, another one's called TRIHEX, Fendil. That's another one. And then the third one is antihistamines. Antihistamines. Oops.
And these are drugs that you take.
Yeah, these are anti-Parkinsonial drugs that you can take. These are anticholinergics that you can take in addition to the carbidopa, levodopa.
Okay.
Okay. They're anti-Parkinson's. They can be used for that, but these are really other anticholinergics,
Okay.
so you don't get confused.
Okay.
They're used in conjunction with carbidopa,
Together.
levodopa, or
Okay.
Cinemex.
So you'll see this, either you'll see cinnamon or you'll see these, or
Yeah.
you won't see them together.
You could if they, I'm assuming since it came up in the Farm 2 remediation
Yeah.
for people, you might have anticholinergic like any of these three, and you wonder, why is it this, you know?
Right.
Or you'll look at them, maybe there'll be a list, and you'll be like, it can't be that,
Right.
you know, because it's an anticholinergic. That's why they would give to Parkinson's patients.
Mm.
Okay, and then also would have the same side effects as any other anticholinergic.
Okay.
So these are synthetic, so there's less adverse effects.
Okay.
Okay, just it says also use cautiously with older adults. You know, the same as any other. Okay. There's also a handout in there. There's like a list of autotoxic drugs. So
Okay.
you just have to look at them and see.
And that's what you take if you have toxicity, right? You
Yeah,
take those
you're
autotoxicity
gonna have autotoxic hearing problems because of it. Yeah.
because of it.
Okay, so this is again on antihypertensives, because they're just gonna build up on what you took,
Okay.
you know, because it'll be a lot of the same drugs, but they're gonna ask you different questions about it,
Okay.
you know, hypertensives.
Yes, thank God. Well, I'm glad we're getting this study in.
So if you know, since I'm building up on the stuff that was on previously, and then added some of the new ones that I just went over, you should be okay.
Yes.
So. Okay, as far as, this is the subject, but it's talking about sympathomimetics, mimetic agents. It's gonna go against antihypertensive medications,
Okay.
okay? So
Okay.
that's why I have it underneath that, because it was labeled under hypertension, but it's talking about what is going to do the opposite for somebody who needs to be on hypertensive meds. So it decreases the therapeutic effects of antihypertensives. I'll just put anti, okay? Because you know how antihypertensive are beta blockers,
Mm-hmm.
or they're also called beta adrenergic blockers.
Yeah.
Yeah, adrenergic.
That's
Okay,
our
these are adrenergics drugs. So it's the opposite. Okay. And they work by these increase the heart rate. So if somebody's on antihypertensives, I'm assuming this probably is an emergency situation because sympathomimetics, those are your, we talked about it before, your positive hydrotropics.
Right.
Yeah.
That's what you want to give in the event
Yeah.
that, you know, so you have a reaction.
So it's going to increase the heart rate, and these are drugs like your epinephrine, it's talking about here. And epinephrine increases your heart rate, right? Increases heart rate and by increasing the contractility, by the way, the pumping.
Okay, increase it.
And it's your epinephrine, your norepinephrine, and what else? And also that's it, phenylephrine. But you know, it's also your dobutamine,
Okay.
dopamine.
Okay.
Okay. So it can lead to cardiac arrest. It's used to treat cardiac arrest. For somebody, you know, you want to get it started pumping back. It's also used to decrease, to delay premature labor.
Okay.
Okay.
Dopamine, right?
Yeah.
Delay premature.
And it's used in acute asthma as well as bronchodilators. You know, the epinephrine. That's it for that. So these are the opposite of antihypertensives. Okay.
Okay.
All right.
Which is
But
called
it's talking
sympathetic.
about-
They call it sympathetic.
Yeah.
Okay.
Yeah, it's called sympathomimetics agents or adrenergic drugs.
I've heard right.
So I'm assuming it's going to talk about how it can affect somebody who's on antihypertensives and why, or when it would be used for, which is, you know, somebody who has
Acute
asthma attack
attack.
to delay labor. Somebody maybe they're on premature labor or something. They can use it for that.
Okay.
And then the last one. This one's, you know, they're all, everything I talk about is in handouts there, but I like this one because it actually has a picture.
Okay.
But you know what this is?
As with the penis.
Yeah,
the
there's a picture in there
yeah,
too.
the picture, yeah.
I didn't put it in there, just printed it out and it just has an erect penis.
It don't go down. It
So is this
says,
going to be like Viagra or?
Yeah,
Okay.
it's, just so you know, it's an uncommon
I read that last.
condition of a prolonged erection.
Okay.
It's painful, okay, and usually not associated with sexual arousal, not as a sexual arousal, usually. Okay. So that meaning 60%, I'm running out of, has to do with some kind of, or idiopathic. Okay, and the other one, 40% are usually for some kind of spinal cord trauma.
Oh wow.
Cord trauma.
What's idiopathic?
It could be anything.
Okay.
Okay.
Like any type of
Yeah.
trauma or something.
Yeah.
Okay.
Spinal cord trauma. It also says sickle cell disease.
Oh wow.
Sometimes some severe infections can cause it.
To make it arouse?
It can cause some kind of,
It can cause the perius of like.
it's like, you know, how there's like blood vessels that go through the penis to make it arouse. Sometimes if there's an infection or they have leukemia even, anything has to do with the blood flow, sometimes it can affect them like that.
Leukemia.
Also with cocaine use.
Don't do no shrubs.
Yeah. So currently the most common reason right now is because of the your Viagra's and stuff. Sometimes they have intravenous intracavernous injection, which I actually injected into the penis for impotence to be is the most common cause right now
Oh wow.
for this.
Poor old man.
Yeah. Idiopathic type is prolonged sexual stimulation. Is the initial development for this. So left untreated, they can leave them impotent.
Okay.
Because it can cause venous obstruction, and in that way, the blood can't flow through the penis and make it give it an erection. Okay. And the Viagra's, they're called
Slide and fill.
Yeah.
Yeah.
What?
Slide and
It's like,
fill.
it look like slide and fill.
Phosphodiesterase inhibitor. Diesterase inhibitors.
Because it's not something.
Just so you know. So just remember, it's painful. It can lead for them to be impotent, and it can happen because of spinal cord trauma, any of those, and
Okay.
Viagra, okay?
The Viagra is
Yeah.
leukemia and sickle
So
cell.
usually, say they took Viagra to be like, yay, but then all of a sudden it won't go down. It's
Yeah.
not about sex anymore. They're
Yeah.
like, it doesn't feel good anymore.
Now you're just screwed.
Like-
Literally screwed.